Dr. DeMarco, what data are available to support the efficacy of the third eye?
Well, there are 4 published clinical studies looking at the value of the third eye in helping to find more adenomas. I'll talk about the last 2. The first one was called the DRAW study, and that was a learning curve study, and it was really more of a study of the technology and the endoscopists more than the patients. And what it looked at was how quickly experienced endoscopists who had no prior experience with the technology were able to adopt the technology and find adenomas. And so each endoscopist did 20 procedures, and we divided them up into quartiles. And the most useful way to look at it is to compare the first quartile with the last quartile, the first 5 procedures with the last 5 procedures, and look at the increased adenomas found over what we'd normally expect in patients who were having colonoscopy. And the first quartile, the docs or endoscopists found 15% more adenomas than they would have at baseline. By the time they got to the 4th quartile, the additional adenomas found with the third eye technology was 25% compared to with the colonoscopy alone, without the technology. So the doctors were able to embrace the technology and use it without having to go back to school, and they were able to accomplish their examinations and find additional adenomas. The second study that I want to talk about is called the TERRA study, because the first study was not randomized. It was compared, the endoscopist said whether he found the adenoma he judged by the technology or by just the colonoscope alone. It was up to his judgment. So what we did was we had a large randomized multicenter trial where the same patient had 2 procedures on the same day, same sedation without even waking up. And they had a colonoscopy, a standard colonoscopy, or first followed by a third eye colonoscopy, or vice versa, and that was assigned randomly. In fact, we didn't know until the patient was asleep which procedure we were going to do first. And we filtered through all the data with that, and it was really a great study because it was a tandem colonoscopy study, which is hard to do and hard to find when you look at the literature. Anyway, we determined that using that the data from that study, that we had an additional 23% adenomas, 23% more adenomas found using the technology, the third eye technology.
Wow. And I understand you did a subset analysis to look at some of the other variables?
Yes, we went back and looked at the data and tried to figure out what patients would benefit the most from the technology, and we really had some interesting findings there. For all comers, it was 23%, but then when we looked at the individual patients and their reason for having the examination and where we got the most bang for your buck, so to speak, as far as the use of the technology, we found that if they were undergoing surveillance, that is, if they had a history of colon polyps in the past and this was done just to follow up, then we had a 32% or 36% increase in adenomas found. Which is pretty significant. Then when we looked a little deeper and we looked at patients who were undergoing a diagnostic colonoscopy for symptoms, those patients had a huge increase in adenomas found with the third eye. That is 55%. The numbers are very impressive for that group. Also, we went back and looked at what was a miss rate for large adenomas. And with the standard colonoscopy, the miss rate for large adenomas was 12%, which is about the same as we see with CT colonography. The miss rate for large adenomas using the third eye technology was 0.